Welcome, everybody. Welcome to this Find the Link series on fertility. It's a brand new series. The last one we had was last year in May, and that was on parenting. If it's your first time here, I'm Dr Aiyedun. I'm also known as the Praisingchild, and this is Find the Link. We've had Find the Link series on relationships in 2020, and we've had Find the Link series on parenting in 2021. They're both on the YouTube channel. The YouTube channel is called Dr Praisingchild. We're here for the fertility series. It's going to be 8 weeks long on the Saturday. It's supposed to shed light, give hope on issues relating to fertility, because we know that that is a pertinent and topical issue for a lot of people. If you know people who might be in this circumstance, you might want to invite them or share the YouTube channel with them after now. And with me today is Mrs. Busolami Jeremiah-Yusuf, who is our speaker today. Before she starts speaking, I will just show a PowerPoint presentation that talks about the group briefly. Okay, so this is the fertility series. Find the Link is all about building healthy and healthier relationships, marriages, and having strong children who are change makers of tomorrow. We've had a series of relationships, like I said. We also have 2 groups online on the WhatsApp platform for parenting and relationships. The one on relationships is open to singles and marrieds, singles of all variations, married of all variations. And they're all welcome to a forum where we can together build healthy relationships if we've not had that, or if we have healthy relationships, build healthier ones. So that's for the relationship group. It's called Find the Link Relate. And we have Find the Link Parenting, which is the parenting group in which we encourage parents in their parenting journey towards building strong, healthy, and godly children. And that is online as well. If that's something you want to be part of, please leave a message and a contact, whether it's an email. So 8 weeks. This is the way you can reach out. Someone will put a link shortly. You can send a message to davidtalkwithpraisingchild@gmail.com, or you can text +44 7444 727 855, and that is WhatsApp only. Okay. So I will just bring our speaker on. Going to start speaking. I would introduce her shortly. Are you ready for us? You're muted. You're muted.
I do this all the time. Hi, good evening, everyone. This muting and unmuting. Good evening, everyone. Thank you very much for inviting me again. I remember when we had the parenting session, we had to talk about fertility briefly, and how to starting a family, preparing yourself and all the likes. And it's so, I'm really happy to be here again. Thank you very much for having me today.
Yes,
and
it's a pleasure to have you.
Thank you, and everyone here today. Thank you so much for your time. We're going to just kick in very quickly.
But before you kick in, let us introduce you now.
That's all right.
She's rushing straight into it. And so the series she spoke on was preparing for parenthood. That was the very first session in Find the Link Parenting, and she took it from a nurse's point of view, and there was another couple who was the gynecologist and pediatrician combo that also spoke. That's on the YouTube channel called Dr Praisingchild, in case you want to find that. And Busolami is a great sister and she is a trained nurse and midwife. And right now she works as a fertility nurse in the NHS in the UK, where she resides with her husband. Okay, so over to you, Busolami. I would put you on the screen, and a big welcome to everybody here. Again, I can see some very great people here. I don't know, obviously I don't know whether you can hear us at all. Can you hear us, or you can just see us? Can't see us. Okay. Nonetheless, I would put her on the screen and let her start work right now. Okay, over to you.
Okay, thank you very much. So I'm not going to jump again. I'm just going to take it slowly. All right. Thank you very much once again for having me. It's always a privilege to having to speak to people about what really is important in their lives, about stages in their lives that can be very challenging. I mean, if they could do anything, they would do everything. And we know that everybody knows that it's God that gives children. But at the same time, we are also participants. There are things we must do and we must know about allowing this happen to us, you know, and also not living our lives carelessly or living lives by being reactive. You know, you have to be proactive in everything, even in our health. That's why you want to eat healthy. That's why you want to sleep well. That's why you want to add value to your life to be more productive at work. So your reproductive health is very important. And that's one of the reasons why I find it privilege having to speak with people about their reproductive health, especially, and how they can maximize it. And when they have challenges as regards conception, information is so key. Information is very important. Little things can change everything. You know, what you don't know can be what you're spending money on, and it may not be necessary. Prevention is cheaper and better than cure. Very simple put. So today I'll be talking about overview of IVF. Everybody has heard about IVF, in my opinion. I think so. I think the world has moved so fast that everybody has an idea, even the young ones, the teenagers coming. They have an idea about IVF, they know what it's about. So in their minds, it's an option. So we can't shy away from it as adults. We can't shy from this older generation, not knowing what it's about, or still nursing myths about it, or cultural reservations about it. It has come to stay. It's a therapy. It's an assisted way of getting pregnant, and your uptake to it is your knowledge. You know, knowledge is power. What you know can help you. What you know can save you. I don't know if anyone is on the call. Just let me see your hello. Let me see your hi. Let me see your I'm with you. Just to be sure that we're all here, because we are going to have to participate in this, so that it's if we have this one-on-one communication.
We are here, live and direct.
Thanks, Bola. Thank you very much, Bola, for that. That's good. Thank you so much. I'm looking out for more. Okay. I've seen Bola. I can see everyone, but I just want that to be sure that everybody is here. And with the little time we are going to spend together, okay, thank you. The least time we're going to spend together, we maximize the time, basically. So I'm just going to share my screen, but just want to create a background. Thank you, Patra. I'm just going to share my screen on just a brief overview of what IVF is about, and also to touch on one or two things that people have, that gray areas. For example, why does IVF not work? Why is it expensive? You know, what are the issues around it? You know, things like that. So we will just touch on those things. And then, yeah, but before I also go on, I also want to add that I've been practicing fertility nursing for about 10 to 12 years now. And I find it as one of the most interesting practice one can find, because it's an opportunity and a privilege to be in people's lives at a very important stage. A very important stage in life is when the child is born, and at their different landmarks, and when someone's about to die, when someone wants to have a child. It's such an important place to be, or when someone is trying to conceive a child. So it's so key, and everybody knows that having a child levels everybody. You are Black, you are white, you are Caucasian, you're young, you're old. It puts everybody, rich or poor. Then we had that. You put everybody on the same level and the needs are the same. The feelings are the same. The pain is the same. The guilt is the same. The feeling of failure is the same. It's the same across board. So because one is rich or one is poor, or you live in Nigeria, you live in the UK, you live in America, it doesn't change it. It's the same feeling. And whoever God gives a child to, they know how to nurture, how to grow, and how to give the child the best. So enough of the background. I'm just going to share my screen right on. Okay. Just confirm to me when you can see my screen.
We can see your screen.
Okay, let me put on slide mode, slideshow. Alrighty. Yeah, so this is an overview of IVF. That's the topic. And I'm just going to show us a short video that explains everything from beginning to the end so that we can have an idea, because this is the foundation to what we're talking about in the weeks moving forward. So anything you grasp by images, just keep it somewhere. Just keep it in your mind somewhere, because you're going to be needing that information moving forward. And if you want to jot anything down, feel free. And also feel free to ask questions, because I expect to have more questions at this time, because everybody has questions in their mind concerning IVF. It's expensive, all of the questions, just have it so that we can clarify that. And by the end of all of these sessions, our minds will have shifted. We will have a better perspective to reproductive health, one. Number two, to how we see our bodies. Number three, and how to talk to people who may be having this, instead of giving them a wrong advice, or just, killing the thoughts at all, or just making them feel terrible for even having to think about having an assisted reproduction. We would enhance the thoughts. We'll be able to direct them correctly and be able to even give answers to some of their questions, even at this level, because everybody should be well knowledgeable about things. Okay, so I'm just going to play a short video. It's about 3 to 5 minutes on how does IVF work. Just follow it very slowly, okay? Thank you. I'm just going to mute myself, and I should mute myself. I think that's just play.
Making a baby.
Let me know if you cannot hear well, or there's a challenge with the media.
Anyways, to parenthood.
Oh, good.
In vitro fertilization,
oh, good.
or IVF, brings the miracle of conception into a laboratory. It has led to the birth of nearly 10 million babies since the first successful fertilization procedure in 1978. So how does it work? Let's take a closer step-by-step look at the process. Step 1, preparation. The IVF treatment process begins long before any egg removal and fertilization takes place. You'll need a thorough medical history before treatment begins, plus fertility tests and analysis for you and your partner. As the procedure gets closer, you may be prescribed birth control pills or estrogen to control the timing of your menstrual cycle and maximize the number of mature eggs available for retrieval. Step 2, ovarian stimulation. During a typical ovarian cycle, only one egg becomes mature enough to ovulate. IVF treatment uses injectable hormone medication to bring a group of eggs to maturity to increase the odds of a successful pregnancy. The type, dosage, and frequency of the medication will be tailored specifically to you for optimal results. Monitoring of the eggs may occur daily or every few days during this time to determine when they mature. A final trigger shot is given exactly 36 hours before the scheduled egg retrieval to finalize the maturation process. Step 3, egg retrieval. Once the eggs are mature, it's time for egg retrieval. During this step, a suction device connected to a long, thin needle is inserted through your vagina. This will puncture ovarian follicles and pull the mature eggs out. Removed eggs are placed in a petri dish containing a special solution and then placed in an incubator for a short period of time. Since this procedure is mildly invasive, medication and sedation are used. Step 4, fertilization. Fertilization of the eggs takes place within it during a procedure known as an intracytoplasmic sperm injection. or ISCI, a single sperm is introduced into each mature egg. On average, about 70% of mature eggs will successfully fertilize. Step 5, embryo development. Now comes the growing and waiting. Fertilized eggs are monitored and left to develop over the next several days, with cells actively dividing. About half of fertilized embryos will progress to the blastocyst stage when they are suitable for transfer into a uterus. Embryos that are suitable for transfer can either be used right away or frozen for future transfer. Step 6, embryo transfer. Within a week after fertilization, it's time to transfer the embryos. This is a short procedure that only takes about 10 minutes and feels very similar to a pelvic exam or a pap smear. A speculum is placed within the vagina, and a thin catheter is inserted through the cervix into the uterus. An embryo or embryos are then injected through the catheter into the uterus. After an embryo transfer, you may experience symptoms such as mild bloating and cramping, breast tenderness from high estrogen levels, spotting, and constipation. Step 7, pregnancy. Within 14 days after the embryo transfer, a blood test will be done to determine if you're pregnant. If the pregnancy test is positive, you begin the journey of prenatal care. Pregnancy success rates per embryo transfer vary depending on the age of the woman at the time of egg retrieval. If the pregnancy test is negative, you can try another embryo transfer if you have additional embryos frozen from the first IVF cycle. If you do not have remaining embryos, you can try IVF again. IVF has been used successfully for more than 4 decades. Talk openly with your healthcare provider about your options.
Thank you very much, everyone. I hope you followed that. I hope you followed that video.
Yes,
so from the videos, good. So from the video, they explained all the process. It doesn't just start one day and ends one day. You know, there's a process that starts. You see your doctor. The doctor does a thorough examination, takes a detailed history of your gynae history, your medical history, all the histories, even psychological history, health history, everything. And those things are very important because they help one to plan and how to walk through the journey. There are different reasons why people would have IVF. Of course, the very major reason is infertility, when a couple has been trying to conceive for a whole year without contraception and they've not achieved pregnancy. It doesn't mean that they're barren. It just means that they need medical checkup. You don't sit and then expect and then keep praying. Yes, you would pray. Well, God is not against medicine. God uses medicine to heal, and that's why He's given the knowledge. And I believe the knowledge of assisted reproduction is God-given, because there are many weights in between. There are many open on God in between. That's the only way one can explain, because conception itself is a miracle. There are many going to plant a seed and waiting and watching that happens. And that's one, nobody can influence it. It's only God that makes it happen. But because it doesn't happen, doesn't mean that God hates you, or doesn't mean that something has happened, but it just needs a review. But we're just going to go to the reason why, what affects the successes of IVF, basically. I mean, you must have heard about people who have had IVF done and it did not work. Maybe 2 times, 3 times. I wondered, this IVF does not really work. And then that creates an impression, that creates a mindset. And of course, if one needs, you don't want to spend that kind of money and then flush it down the drain, because that's the picture it paints. There's no sign that you spent money, or the only sign I won't spend money on such a procedure is that the person gets pregnant. But at this time, there's no pregnancy, because you can't see the sperms, they are cellular in structure. You can't see the eggs, you're just feeling some drugs being given to you. You can't even see the embryos in some centers because they are under the microscope. You just know that some things are happening, and then you just follow like that. And then there's always most times, there's loss of control. Just not in control of your body anymore. The drugs are controlling the emotions, controlling your mind. It can be very overwhelming. And I say to many of my patients, and all of my patients, most times, the IVF is expensive. Now, in the UK, of course, is sponsored by the NHS, but not everybody gets the funding, and they wait forever. But I mean, the place like Nigeria is private and most countries. So if we can agree that it's a capital project, it has to be planned for. But what will affect a success rate? So these are the things that you want to look out for if you're about to go into one, or you know somebody's about to go into one and you think this will help you, why don't you consider reading about this and see how it will help? For example, the first is maternal age. That's the first and one of the topmost reasons why IVFs may not be successful. Maternal age is such an important factor. The reason is because the reproductive years of a woman are set already, and they are set in before she was born. In fact, while she's in her mother's womb, at about very less than 3 months pregnant woman has already, the template for the girl-child reproduction is already set. And the number of eggs she's going to have is already set. So then she keeps on ovulating them until she gets to the period of menopause. So, and that makes the period of reproduction protracted. So with that period of time, if it elapses, it becomes a struggle. It becomes having to make decisions on wanting to do other therapies, on having to have multiple trials. So maternal age is such an important factor that must be considered. So when one is going to this procedure, so maternal age, I'm trying to say very young age from 20. Nigerian people get married early, the northern states, but once a woman is 1835, her reproductive capacity begins to sharply drop. Is proven sharply drop in a very high percentage, drop to, and once you get closer to 40, there's a lot of reduction. And then that can be worked around. With that knowledge alone, it helps one to make a proactive decision early. Of course, not to put one under pressure, but to be knowledgeable, to know your chances and to know how to address the situation and to know how to prepare for it so that you don't, one doesn't have a high expectation. So you're going for an IVF and then one is about 39 and you're expecting it to happen the first time. It may not happen. It's not being pessimistic, or how do I put it, but it's just being realistic. It may not happen the first time. Whoever tells you happen the first time may be giving you an unrealistic expectation. So you have to really count the cards and know what really works. To say, okay, well, do you want to prepare for 3 cycles or 4 cycles so that you are really prepared for the shocker that may come, for the disappointment that may come of a not pregnant after having to spend a lot of money, time, energy, emotions. So it's very important that you're well prepared. And it's also another thing that is not on the slide I need to talk about is support. You must have a support structure because it's expensive emotionally. It's going to drain a lot from you. As a woman, we are just emotionally based somehow. Our estrogen and progesterone is everywhere. Our hormones are everywhere. So you really must have support. You can't do it alone. Either support from your healthcare provider or support from your family members or support from your spouse or support from your partner. You must have that back support. If you're going to do IVF as a single woman, who is your support structure? Okay, so you must be able to figure that, pen it down and get the person on board very quickly so that when times are looking rough or you need to make a decision, you have someone to help you out and raise you up when the time is going low, right? So we're just going to talk about maternal age. That's where we're coming from. Another thing is BMI, body mass index. What's the rate of your height and your weight? So in local Nigerian English, how big are you? What's your fat level? Let me put it that way. And it's so important because the hormones that allows for ovulation are fat-based. So if you're giving this medication, before it gets to the ovary, the fat of the body is absorbed by a number. And before it gets to the ovary, it takes a while and just a little, and there's very less response at the point of using medication to stimulate. So it's very important that there's good weight loss or weight loss program ongoing. I'll give an example. I had a client who she's about 26, very young lady, 26. And I could see that she was really gunning at this getting pregnant. Nobody was going to stop her. And I was asking my mind, like, you're 26, Auntie B, take it easy. She was just very determined. She'd had some 5 cycles, it didn't work for no reason. We could check everywhere, everything was right, everything was okay. I think she figured somehow. And she had a gastric bypass. I felt that was extreme. Like, you didn't have to do that. And she got pregnant straight. That to me got in my mind that this is very important. I mean, this is very, a BMI was a problem and she knew it. You know, I noticed she lost it because I saw her stretch marks. And I'm like, what did you do? Something has happened to you. I've lost weight. What were you doing? She had a gastric bypass. And with that, I just looked at her and I knew that she was something that happened in her mind. What am I trying to say? These are people who have gone extra mile to do some research and to read and to know what are my chances and to put it in paper, not even being emotional this time. Of course, money is involved, but it is also important to put pen to paper and do proper analysis and checks and be sure of what you're going in for. It's a very, very intense deal, not to scare anyone, but let you know what it will cost you so that when you're in the middle, you don't get angry and get upset at everybody. You know exactly what you're going in for. It's also as going in for any other form of surgery. Maybe you're going in for a kidney transplant or a heart surgery. You won't go in there passively. I find out that most people, I mean, in Nigeria, go in passively and they get shocked at what happens in between. And I'm like, you can't be shocked at spending about 5 million naira in something. You must put your heart to it. You must follow through. You must understand every step, every process. If you don't get it, you ask questions. You must follow through. You must ask your doctors, your nurses questions. Why is this and why is it like this? They must give you explanations. If they do not give you, they are not competent enough to look after you. So if they cannot give you, if they don't even have the answers, they must get it for you as a professional, because you may not have the resources as much in your hands, but the internet is open to everyone. At least you have ideas, but they must be able to explain to you. They cannot explain to you categorically why your cycle has failed, but they must give you cues that will get you there, that are peculiar to you. But being blank is not an option. Even as in yourself going through the procedure, you can't afford to just follow what the leads of the doctors. Yes, that's the culture, but it's not acceptable anymore. You must have an idea of what your BMI is, what's the ideal, and then work towards it. That's a goal for you. You must also know, okay, what are your chances as regarding your age, and ask the doctor, what are the chances, what are your success rates for a particular center for this age group? So most centers will publish. Okay, I think person has figured out. Most centers will publish their. Can you hear me? Okay, most centers will publish their gold standard. What do I mean by gold standard? They'll publish their youngest patient who doesn't have any issues, basically who has the best specimen parameters. That's what they will publish. And of course, they're not lying, they're honest, because that is their best. Everybody wants to put out their best and their best foot forward. But you must ask the center, what is the success rate for your age? Then they can narrow it down for you. And they will, because they all have the data. The data exists. But if you put everybody in a bag, the 45s, the 32s, the 28s, the age range, put them all in a bag, it reduces the success rate. So maternal age and BMI goes a very long way. I'm just going to show you this graph. If you look at it, pregnancy rates for a lower BMI is very high. All right, not the thinner you are, but the right proportion of your height and your weight. The ideal BMI, it should be at least less than 30. For the NHS, once the BMI is over 30, they're not even going to get funding. But their ideal BMI is less than 30. And even aside from the BMI less than 30 or getting the funding or not, you should watch that if you're trying to get pregnant. Some people, that's the only reason they're not getting pregnant, because they have a lot of muscle mass, a lot of fat mass as well. So, and of course, eating healthy and losing some pounds will help to achieve that very quickly. So I'll just move. Another factor, I'm going to exhaust all the factors, just pick out the most important, are the sperm factors. I was doing research some time ago, and in Nigeria, I found out that one of the leading causes of infertility in Nigeria, in Lagos, I mean to say specifically, was the semen parameters. And that was rather interesting to know. And we're looking at to see what exactly would have been the problem. It can be explained. The lifestyle, feeding habits, the environmental factors, let's leave the maybe when the child was young, the child had mumps, because boys that have mumps when they're young, it could have affected their testes. I mean, their testes and sperm parameters when they grow older. So those things affect as well. But we also want to see what kind of sperm does your spouse have, or does your partner have, or does the center have, in case you want to buy, for those who are going to use donor sperm to get pregnant, you want to find out the parameters. For example, the most important parameters are the count. How much of the count can you find in the sperm? So what's the sperm count? That's the colloquial way of saying it. A sperm count of less than 15 million per male or less than 39 million is not too fantastic. Now, it doesn't mean you cannot get a woman pregnant. It just means that may be one of the reasons why pregnancy hasn't happened. And these things the doctors are going to check as well. So when they give one a semen parameter result and you don't know what it is, or they're saying a low sperm count, you must ask them, okay, what exactly are the goals? What do you need to do to get you there, right? And it requires a lot of attention and work. For men, semen parameters can be worked around by adjusting lifestyle, reducing stress, diet, of course, stop smoking, reduce alcohol, and of course, weight loss. Because it's thinking that men can just get it on. No, it doesn't work that way. And of course, age affects the sperms of men as well. So they're not just left out, they're actually very, very important factors. And but another important factor is the way the structure of the sperm. So if you look at the right-hand side of the screen, and my cursor moving, you can find the sperm has three parts: the head, the middle piece, and the tail. Now, it must be this LD to be able to fertilize an egg. It must be that LD. If it has any of the aberrations in the left side of the screen, it's just a waste. Yes, a man can have that 45 million sperm, but they are bad. That's another part of it. They have the tail, they can swim, but they're actually having structural problems. And these structural problems can lead to miscarriage. It can lead to infertility. It can lead to non-fertilization of the eggs at home. And this can be caused by quite a number of things. And when a doctor is noticing these things, they would give a referral, they may prescribe some medications, and they give some advice. When they give this advice, they're not trying to be funny. They're just trying to get the person there, and they'll say to come back in 3 months. But we know that change is very difficult for all humans, and having to the issues surrounding making great sperms are usually habitual issues, like smoking. You can't end smoking in 1 day, neither can you end it in 1 week. It's a habit. It takes a while. It takes total mindset change, and also with support of a group of people or a therapy to get it to the point of not smoking. And alcohol intake, you didn't start taking alcohol in 1day, and it's not going to end the next day. So stopping alcohol must have to work around knowledge, must have to work around having to understand why. Why is alcohol affecting the sperm? If you know a why, it's quite easy for one to be able to change a behavior. So these are the few reasons why a cycle wouldn't work. And also the clinic also can give other reasons, and they're going to explain it out. After having an IVF cycle, because I believe some people will know, one person will know one person or two people that has done it before, or they are planning to do it, or they are thinking, should I not? It's expensive, I waste my money, it's not working. But to know that it works, but you have to really understand the process. You have to count the cost. You have to know what are your own personal challenges to it and how to mitigate it before you begin. And also to plan for failure as well. Failure doesn't mean that that's a sentence to barrenness. No, failure doesn't mean that. Just means that particular trial, that particular fertilization, that particular conception for that month did not work. As easy as it's said, I know it's quite expensive, but that's how it is seen in science. So I'm just going to move to the next slide. So what makes IVF so expensive? I think most of us will want to know that. Why is it pricey? What's the whole idea behind it? So first of all, okay, why is it so expensive? First of all, is the technology. The technology is everywhere in the world is expensive. The technology is one that is a fine technology that at every point, any error made at the beginning is going to affect everything. And everybody's, all the teams are involved. So whoever makes an error from history taking is going to everybody's going to eat the rocks. So the people who are involved in it are specially trained for justice alone. This is all they do. And they can imagine the energy, can imagine the time it takes. And they're always very sure. They can tell you what will happen because it's how do I put it? Because it is it's science. Sometimes, yes, science can be predictable. Of course, there's some factors that can tweak it a bit, but they can tell you, oh, this egg is not going to fertilize. This embryo cannot achieve pregnancy. They're certain because they know the progression of cell growth. They know the progression of how implantation occur, right? They understand the process. They'll say this particular sperm will never allow the embryo to get to even 5 months. It has chromosomal issues. They can see that it cannot because they're skewed at these things. And also IVF is so expensive because it has a high risk of failure because of errors could happen due to lack of understanding, due to lack of training, and due to lack of manpower, or due to even just as simple as temperature. The temperature of a laboratory can mess up everything. And that is the back end that most people do not know. One of the reasons, let me just go back to my previous slide. One of the reasons for affected success rate is the last one I put on the screen is laboratory parameters. These are the back ends that nobody will tell. The clinic will not tell the patient that my laboratory was short of CO2 or was short of the medias you need, or the temperature dropped by 1 degree. You may not know because they've gone to sleep. The clinics don't work overnight. They just leave the sperms and the eggs and leave it there and go and sleep. They will go to their house, they will lock the door, and they will come back the next day and come and watch and see what has happened. Something could have happened through the night. Of course, there are temperature logs that helps to check and see what has happened, but it will have happened before they now know preventive action not to happen again, right? In a country where weather is very important, these things are as well checked. They have their parameters that help to make sure these things don't happen, but it can happen, and there's nothing anybody can do about it. But the good thing is that the human gametes have capacity to adapt to changes temporarily. But if it's a consistent thing that happens, or the gametes are not compatible with life, these are the things that make them fall by the wayside. Also, another reasons why it's so expensive is because even from the laboratory point of view, when you have to do hormonal tests, for anyone who has to go to do hormonal test, you know that this like just one test costs you about 5,000 naira. Wondering what is it? It's just one blood test like that, and it's just that expensive. And you're wondering why is it expensive? Because the technology and the finance and the clarity put in it, and they understand the long term and the decision they have to make with that result. And not just that, getting the medias, what the reagents, and they're just all around the world. So let me give an example. There's been issues with Russia and European countries affecting importation, even in the UK. And everybody's having to wait for supplies, let alone coming home to Africa, Nigeria. If there's issues with supplies here, and then things have to wait. So let alone, so everything affects it. What I'm trying to say is that these are the places where what you cannot control, that's why you need a God factor. I needed to bring that in because in having to do things like this, you've counted your costs, you've done everything you need to do, but it's also important to have a place where God comes in to say, I've done my own part. God, you have to do your part. And it doesn't mean that God has left you, like I said earlier, but it just helps you to be able to cope and able to manage the what you cannot do anything about when you are asleep, what you cannot do anything about that other people are going to be doing on your behalf. Okay, and there are places where decisions will be made. So I just want to give another example again. On the NHS funding, the embryologist and the doctor decides if they are going to have to do an ICSI, like you watch in the video, or they will just leave the sperm and the eggs to meet each other. Where I'm coming from, Nigeria, I think, please don't wait for any sperm and egg to meet anything. They've come a long way, 2 years. Why don't you just give them precision, give them ICSI, and let them get going? And they'll have to wait and affect pregnancy rate as well. Because some of the eggs, the head of the sperm cannot dissolve it because the coat is too thick for whatever chromosomal reason. And that's the issue why this lady has not been able to get pregnant. But you can't know, because that cycle must fail before they don't realize. And I'm like, but I also realized that then we just figured out that we woke up one morning and said, this is not working. Look at our rates are going low. Give these people this for the first time and let them go. Time to pregnancy must be short. I know that this must be a response to somebody else's prayer or something. We just woke up one morning and then we changed it. But back home in Nigeria, everybody does ICSI because nobody wants to tell stories to a patient that after paying 5 million naira, I did not get pregnant. Why? You must be able to explain. But yeah, you don't have to explain to me. You didn't get pregnant, move on into another cycle that's been paid for by the NHS. But these are the things that can change decisions, can change policies. And that's where the God factor comes in. An unseen that just blows everybody's mind and directs our thoughts in another direction that will lead us to a better outcome. It's going to favor the person. All right, so just that's one of the few things I've learned in my years of practice. And I see that it has proven over and over and over again that there's a major God factor in getting pregnant, and also definitely in having an assisted reproduction when it has to be done outside the body. I'm just going to run through very quickly again. I'm just going to talk about the benefits and then we'll have it a wrap. Benefits of IVF, of course, it overcomes infertility. Now, infertility in that sense means that it helps to overcome the blockages and the barricades. So for example, if the sperms have this kind of parameters, the parameters on my left side, they're not looking great. It's not possible that all the 39 million or 40 million sperms will have this. So when an IVF is being done, the embryologist or the scientist in quotes select the best of sperm. They actually sit. It's as if you're picking beans. I like to use that. You're picking beans, moving the stones and the dirt, and they will sit down with their back aching and their neck almost falling off, and they're painstakingly with patience bring out the best of sperms to inject the eggs. And it takes someone who is fine, someone who is patient to do that. And that's their job. They actually do it well. And they take their time and they find it. A woman cannot have 39 million eggs. It's not possible. Max she would have is 20. Max, let's say 30 that she would have. So they need just 30 sperms. And they will find it. And they will inject the eggs. And that's why they can that part of male factor infertility can be overcome. I said another one, when the coat of the egg is too thick, any woman can have that. She won't know. She's just ovulating, everything going on well. She's not getting pregnant. Why? But that coat is, for some reason, genetically thick. But what the IVF does is that the embryologist will just remove the coat. They take out all the coat themselves with their instruments, with the machine, and they just inject the eggs. And she goes on well with the pregnancy. Some people have blocked tubes. First fallopian tube is blocked. The second one is blocked. There's no how she's going to conceive. And this is where this comes in. Some have very low ovarian reserve due to age, due to early menopause. Women are getting to menopause at 30, at 28. It just happens. And she has very few eggs to ovulate. And this is a very good way to get her to conception, not just that, to preserve her fertility. So at that young age, she has realized that her ovarian reserve is getting low, so she can batch and she can keep her eggs and keep her embryos for future use. So she's not stranded, or she's not surprised when she wants to have a child when she's 35 or 38, and then she's ready, she's well in a good state to have a child, to nurture a child, to parent a child, and she's ready. She's not surprised. She can as well have that done. That prepares her for future. For a woman who is unmarried and this man is not coming early, what do? You can't wait for someone to tell you. These are ways you can make a decision. It's okay, yes, I don't want to get to 45 and then find a man and we have to start to think about what to do about a child. One of our dreams in our life is to have a family, to have children of our own, genetically of our own, not having to have anything donated or anything. That's her. She's clear about that. And she goes ahead and go and freeze her eggs for as long as she wants to. And she's free from the pressure. All the pressure of having to go out with whoever, she's free from that, and she can move on with her life and get whatever she wants to get. So that's one of the benefits of this. And of course, for those who dream to have multiple babies, that they must have it in their lifetime. There's nothing that can tell them must have it. Nobody can change their mind. And you want to make sure it's precise. This is for you. So it's something you want to explore and ensure that this happens. If that's what you want. And of course, it has its own risk. Your doctors would advise you on the risk, but say, no, this is what you must do. That is one thing that would help. I think I'm just going to stop now. I think I've spoken for too long. And I want to take questions. I believe everyone should have 1 or 2 questions or anything to clarify so that we can build on this in the next series that we'll be having. I don't want to bore you with too much of information, but just to say that this is a foundation. And of course, when you're coming in next week, please come with your questions. We're going to be taking question time. But if you have questions or any additions of your personal experience and that you want to ask questions, please, this is the time. Thank you very much, everyone, for listening.
Thank you. Thank you so much. You might want to stop sharing your screen so that we can see you again on the big screen. Okay, great. So I think somebody asked a question. Moody Ramatola asked a question that can a woman with the age of 40 years go for IVF after having 2 children before?
Absolutely, you can have IVF at any point in time. And just to add, fertility can be primary or secondary. A woman who's never had a child is in primary fertility because she's not had a child before. But women who've had 4 children, for example, and they want more. Desire is desire. You can't stop anything. You can't stop a desire from happening. You can't stop. Desire is like a force. Until it is met, there's no rest. So if your desire is to have more children at 40, fine. It could be your retirement baby, as people say. But please, you can have more children if you desire more. And then if at 40, sure, please go see your doctor. And they will have to run through the test and tell you your chances. And you're good to go. Go ahead and have it.
Okay. Now I'll ask you a question. Have you noticed that there are different conditions regarding people who are eligible to have IVF treatment where you practice? Like maybe above a certain age, they wouldn't do it on the NHS.
Okay. I know that on the NHS, they have their criteria. Why? Because they want to maximize their funding, in my opinion. So if they say their cutoff is 40, because they've learned to the science and say they'll have to do multiple cycles, they will spend more money. Why not to allow the younger ones? In fact, there's some counties that say that if any of the partners have had children before, they're not going to give funding because please adopt the child and make it yours. Why do you want to having to go to and then deny people who've never had before? So it depends on the funding and the policies in those counties. However, let's remove the fundings of the place. But a certain age, the only age by HFEA about age of having a child is 55, simply because of life expectancy. To say that, I mean, a woman who is 55, they're thinking that life expectancy now is about 60 something. How long will you be alive to raise this child and give a child a good start in life and see the child graduate from university? You'll be too old and frail to chase a toddler up and down the house or feed a child. So why do you want to go through that process? So that's one of the reasons why they will cut a age, and it's about 55. I think they've increased it now this time around. So some clinics would put a policy as regards using their own oocytes for the women, for the ladies, and say once you are 41 or 42, we cannot use your eggs or something like that, and they said we will not do it for you, and they go and say go elsewhere. They may have their reasons because they have seen from their results, from their own feedback, and they are clear that an oocyte of a 40-year-old woman and above doesn't achieve pregnancy. So if a center doesn't treat you, you have an opportunity to go to another center. And then there's a patient autonomy to say, this is what I want. I mean, I've treated a woman who was 50. She was 50 and she, instead of using an oocyte, it was a very difficult issue to manage because I had to give reasons why I can't turn her down. She's clear. She signed her papers. You can't turn her down. She could take you to court. She's clear. She's a lawyer. She's clear on what it is. She's counted her cost, but she wants a treatment. You can't deny her. So it's either here nor there. Some clinics I will just tell you, don't pay any money, just go. We won't touch you. That's fine. But when they're being dishonest about it, that's when it's a bit shaky. But like I said, before you go in to do the readings, clarify, ask questions before you go ahead. And for many reasons, many people would not go for donated cycles. Now you have to use a third party, and you have a right to do that. Nobody should force you to do what you are not comfortable doing. Okay, so there is where you draw the line, and there is where you say full stop. But you won't do what you are not comfortable doing, and then there's autonomy to say yes or to say no. And so is the clinics as well, to be honest. They can actually say yes or no, either to treat you or not to treat you. I hope it's clear. I hope I've not gone off the point.
Yeah. I think we get that. As in, both sides can decide whether or not to go forward.
Yes, they can actually decide.
Yes, whether or not they want to treat somebody. And thank you so much. That's been a fantastic presentation, and I think we've learned a lot within time. So it's great. I think we have more questions here. Someone said, can family planning cause infertility?
Some people from their experiences have used family planning pills, the implants and the yes. I won't say yes, like caused infertility, but it could have caused a delay. One. Number two, they could have they may have made a choice that was not compatible with their body. Let me give an example. So a woman who has a low ovarian reserve, or who has polycystic ovaries, or who doesn't see her periods regularly, who doesn't even ovulate regularly, and goes on a pill or a particular family planning that stops her from ovulating, her recovery time will be longer than somebody who ovulates every month. And then she's worried. But what has happened is that a provider had not done a proper history taking to make her make an informed decision. So that's what may have happened. And some people, the recovery rate or comeback rate for when they have used the family planning back to normal, it takes a longer time, but they won't know until when they've used it. But experiences and that of a family planning provider, giving that clear information will help a woman to decide, because most people use family planning without going for a consultation from a provider. They just use it because somebody else is using it. It's work for them, and it's easier. I can just use it. No. You must find a provider, you must clarify. And there are providers in Nigeria. You must find one, you must be clear, because most of us just use things that works for other people. And I don't think that's a very smart thing to do. You must clarify, because your body is different from another person's body. Very, very different. So you must be able to know what works for you and what doesn't work, or what you never do. I think, and that can cause infertility for some people. So infertility doesn't mean that just after 1 year they've been trying, they'll have to then go to the doctors, and then they will have to assist them in getting pregnant. But a wrong choice of a contraceptive device can actually cause it. A wrong choice, not the contraceptive itself, but a wrong choice.
Yeah, thank you very much for that clarification. I'll just shed a bit more light on that. So Busolami has spoken about the pills, but for somebody that uses a contraceptive device like the ones that have been inserted, if for some reason there is infection in the genital tract, that can cause a problem. further down the line. So in that sense, that could have been a cause of infertility, caused an infection and blockages. What she's mentioned about a woman not ovulating regularly and then using a pill that stops ovulation, most of the time, once people stop the pills, they resume their ovulation again. But when people use some particular ones, especially the injectable ones or the ones that are inserted under the skin, sometimes it takes some time for normal fertility to be restored. Now, it is within that period of it being restored that people get very worried and they begin to think, oh, this is what I used that has caused this. It was just their body returning to normal. The contraception was working as it was designed to work. But this is why we need to be informed. We have the internet. I know there's a lot of information there, but if you probably go on the internet and for different types of contraception and advantages and disadvantages, you'll probably find answers there. And definitely speak to your service provider wherever you are. I don't know whether Busolami remembered, I told her that I wanted her to speak in the native language for those that will not hear what we have said today, because this is important for everybody. And what do you also say about this desire that becomes inordinate, that then means that people begin to do all kinds of things, including visiting herbalists and inserting all kinds of things into their private parts, including visiting people who are not even their spouses just to get a chance. In Find the Link, we are based on biblical principles, so we definitely frown at premarital sex or adultery. Let me just slow that in. Before we go on, let me take Pastor Solomon's question, and then we have some questions on the chat that we'll take right after that. Do you want to unmute yourself, Pastor Solomon, and ask your question very quickly, please?
Yes, yes. My question is, I want to ask what they call menopause. So I want to actually know the age when somebody become menopause, a woman become menopause. And another second question is that some women, when they are on their period, they took in before maybe before the end of the period. That same particular time that they are menstruating, they take in. And I still want to ask another question about family planning, because sometimes some women go on family planning and they still take in. And I understand. So, and sometimes they maybe have duration of maybe 2-3 years, understand, on the expiration time, and about they took in before that time. So, and some, when they are on family planning, they become fatter and understand they lost shape and all of that. So I just want to have clarity about those things.
Thank you very much for your question. I think you've asked so many questions. You have exhausted your question for the next two sessions. But those are very useful questions that I think women would be interested in. Did you get all of them?
Okay, so I got the first one as regards menopause. When does it start? So for menopause, I would say it has an average age of starting. But lately, it's been found that menopause it varies on when does this girl child started to ovulate. Because menopause that she's exhausted ovarian reserve. And the earlier she starts to, the earlier she starts to have children, menopause is delayed. So I'm going to explain it. So I'm trying to find a simpler way to explain it to you so you understand. In the olden days, our mothers used to start to have children at say 19, 20. So you find out that when they are 45, they are still having babies because they've been able to use the 9 months to preserve. They've kept their fertility status much later in life. But now we have people who don't get married early, 30, 35, they're still not married. They've exhausted all their reserve very quickly. They get menopause earlier. So the average age for menopause right now is between 40 to 45, if I'm very accurate. Thereabout. I'm not sure, but I have to really check that.
I think in England,
so if anybody, we have doctors in the
It's about 51. It's about 51.
About 51. But
yes.
for my fertility experience, people get into menopause really early in this day and time. But the book says 51 because they're going to put everybody in the same box. Okay, so if a woman is not getting pregnant at 40, 41, 42 to 45, there's no need to say she's barren. She just needs a bit of assistance in that. She needs assistance as regards seeing the doctor and then telling her how to get to the point of us getting pregnant. The second question you asked regarding a woman getting pregnant during menstrual period is you need to check that because she's actually been pregnant. Probably she's bleeding in pregnancy, early pregnancy bleeding. So most people just find themselves pregnant. You don't know, oh, I'm seeing my period, I'm pregnant. Early bleeding, early pregnancy occur. And most people they don't, oh, it's normal. It's not normal. Okay, you shouldn't be bleeding when you're, but it happens to some people. So that could be how the person's body responds, but it's not normal actually because she could have lost the pregnancy. Right, she could have having multiple gestation, probably lost one or one has gone out of it. But bleeding, those things happen, but needs to be checked. The third question you asked, if I can remember, can you remind me of the last question?
I think it was about weight gain with the use of some contraception.
Oh yeah, contraceptives are hormonal medications, and it will give side effects. Number one, weight gain. Of course, not because it makes the woman eat the whole world, but hormones have allowed women, it's possible for her to gain a lot of weight. Let me give an example. A woman who is pregnant has plenty of hormones in her body. She will gain weight. Okay, so it doesn't mean that contraception is not working. It's just where it reacts in her body. Some people use some contraceptives, it takes away their period, or they bleed more. And it is becoming very concerning. They go back to their provider and they see what they can do and they have it changed. So if the weight gain is not working for her and it's not something she can keep up with, it's good to go and have a change, not to get stuck on it and say that's what is causing and that's okay. Because weight gain is not good. But if you know you can deal with weight gain, that's fine. But she has to go back to say this weight gain is unacceptable. So she must be able to look at that. But it's a side effect. But of course, when you are noticing weight gain, there are things you can do to reduce your weight, but it could be a side effect of hormonal contraception.
Thank you. I just want to add to that because I work as a GP in the UK, and some people tolerate contraception really well, and some people don't. Some people go through all the different types, the injection, the tablets, the ones that are inserted in the genital region. They do all of them and they don't work. And then they decide, I don't want to use it at all. I'll use maybe some other natural method. Some people find one that eventually works for them. As Busolami has mentioned, the weight gain might be a side effect that a very slim person actually wants. So it's a side effect, but some people want that side effect because they've been trying to get some more weight for ages. So some side effects work for some people. Some people have a side effect of some mood changes, but that's also the effect of the hormones. Some people have more headaches. Some people have different kinds of side effects with contraception. That's why one has to look at it based on advantages and disadvantages. Like I tell my patients, there is no medication that does not have side effects. We give medication based on the risk and the benefits, and we are giving you because the benefits are outweighing the risk. So in a situation where you are taking something, whether it's a medication, even including contraception, and the risk or the disadvantages to yourself is worse than the benefits, then it might be a time to reconsider that medication and consider stopping it altogether. I think we have a question here. Or more than one. Yeah, someone has asked a very please, someone said, can you explain how to go about freezing eggs till ready for conception under the NHS? I think that is a topic we are going to deal with in one of the Saturdays coming forward. So we'll save that question for that time. Somebody says, when a lady asks that her eggs be removed and frozen away, what is the chance of getting the eggs viable for conception later? percentage probabilities, please? Is such possible in Nigeria? Percentage is about 20% or less, but we would be talking about that in the session on egg freezing. Egg freezing and donation is a separate topic we're going to talk about. Someone has spoken that, if a woman is not too wealthy to go for IVF, is there another means of getting pregnant because of money? I'm sure this would be a question that a lot of people that are cash strapped want to know, and also because it is expensive anyway.
Maybe I should just say one or two things regarding that. Most people find themselves in that area, but there are centers that have sponsors. People can sponsor you. You don't have to know the person, but they know who the person is who's sponsoring, can sponsor your IVF for you. So you may want to find out from them if they have such. Some of them will also have some kind of shorter payment, or they have an egg sharing process. They have egg sharing process to say, okay, if it is what you want to do, you want to save some cash, can you do this to help you reduce your bills? So you can ask the IVF center what it is they have. They know the challenges for finances is real, and it's stopping many people and delaying them from conceiving. So it's a real issue. But I see that if you have looked at it and then they put the information before you, that's the only way. I'm not going to traditional means that you cannot explain or that will hurt you, but just to also pick on the traditional part that people insert things. I've seen a woman that I don't know what she inserted, and it chopped off everything. It was very sad. And you don't want to be in that situation. So because what is inserted are very corrosive, but they won't explain to you because they have not inserted it themselves. They don't even know the effects because they don't even have the fertility issue themselves. So they have not. It chopped up everything. She had to do plastic surgery for vagina. It's very gruesome. The other lady and two of the other lady had to have all uterus was gone. And so it's so important that you are very informed of what is going into your body, okay? And then be clear about your chances. I really say that a lot of times, and then know what it is that works for you, okay? And speak to your provider. They would have something. They really have something to offer. Thank you.
Okay. Thank you very much for that. I would like you to please speak in Yoruba, summarize what you have said, especially for those who might be trying all kinds of things, especially along the lines of don't do anything that is wrong for you because of this desire. It's better to live long than not. It's better to live long without your own child than to die early, because some people put themselves through all kinds of horrors trying to have children and then die young. And it is completely unnecessary. Your life is as important as the life of a child. Actually, medical practice, we actually consider the life of the mother more important than the child until the child is born. Because if there was a necessity to save one life, we would be saving the life of the mother. That is based on medical practice, as we know it. Although so many things have developed over the years that many times make that unnecessary, because many times even surgeries can be done on babies in the womb. Science has advanced that far. But I'm just saying that don't end your life. Don't cut your life short. It's not the end all be all. Don't commit suicide because you couldn't have a child. Your life is important. You are worth so much. You are precious. You have something to give to your world, even if you had no children at all. So if you don't mind translating that to Yoruba. A lady has asked the question about excessive bleeding during pregnancy, after pregnancy, and fertility not returning. Would you want me to take that question, Busolami? I was telling her that she should send a text to the number for Praisingchild, and maybe I would explain further. But did you want to respond to that, or did you want me to say something about that?
I'll just put a word out. First thing, why anything can happen after delivery. Just during delivery of a child that can affect fertility. But what worries me is the fact that you had to wait for 12 years. That's my challenge. So I know that maybe there could be spacing and everything, but the timeline of waiting is where the complication is. Anything could have happened then, Bob. If you had sought medical help on time, that would have probably changed the story today. There could be many diagnoses. I mean, Praisingchild explained that there are just many things you can bring out from that experience of bleeding after having a baby, and what can happen after. Many things that can happen, and many things that could have happened in between. And those in-betweens are when you need to dig out to say what went wrong, what did you do, what did you not do. So it's very important. Of course, I would definitely will say you have to go and see your gynae, and of course I'll allow Praisingchild to explain better. Me that she must have seen definitely this in her practices most times.
Yeah, it's what you've described can be something relating to your experience during your last pregnancy, but let us discuss further. But yes, it could be part of the course. Let's put that as it is. Okay, yes, the translation now. Go on.
Okay, so I'm trying to pull my bootstrap of all my Yorubas where I kept it. Okay.
A summary, yeah. Just so that those that just that message, the main, yeah.
But I'm going to say it in English first so that Yoruba can come. And one of the things is that it's very, I'll say it in my own way because I got what I mean. It's very important that we know where to draw the line. Like I said before, desire is desire. I mean, a woman that wants a child, there's no stopping her until she has gotten what she wants. But the part that is going overboard is when we allow societal pressure. It is very real. And the truth of the matter is that for a woman, it never ends. You are not married, marry. You marry, have a child. You have a child. You only have one. Have another one. You only have two. Have another. You only have boys. You don't have girls. And they go and they have no marry. And then they're not doing well at school. And it's endless. So for how long in one's life would it be under that yoke and evidence of pressure? You can't live like that way. If not, you'll be moved by every comment everybody says. People, I mean, where I come from, they say whoever is not married has not come to a life. But who says that? There are many people you would make life is what you make it to be. You cannot live under the pressure. Some people will never marry and nothing evil will happen to them. They'll be okay. They'll be very fine and they'll live their lives to the fullest and they will be happy. So you must decide that you are going to be a happy person. Either the child comes or doesn't come. Either the husband comes or he doesn't come. Either another gender comes or it doesn't come. You must be a person who is fulfilled. And you have to decide that it's not all of these things that fills your life. Because if that's one of the things that fills your life, it's not a very important, because the child, you leave it here. The husband, you leave the husband here. So what it is, what is that? What is it that really fuels you? And you must find it. It can't be these things. No. These are addendums to life that makes life sweeter. But your life must be sweet as a person before you can give the sweetness to the world. You can't be a bitter woman because there is no child. No. Because you continually be bitter, even when the child comes. What if the child that has special needs? You commit suicide. You won't. It's your child is your blood. What am I trying to say in essence is that a fulfilled life, a quality life is worth pursuing, is worth looking out for. And you must find that thing that fuels you. So go into Yoruba mode. So laye tawa kirakita yepo. You can't le ma sáré síbi sáré ton torí pé afe lomo ọmọ yìí máa wá bí ó bá dé wá ayé gbọ́dọ̀ dùn. Fúnra ara ìyá tó wò pé báwo mo ṣe lè gbé ayé tó máa ná àlàáfíà. Èèyàn bímọ èèyàn máa gbé àlàáfíà. Being bá ṣe lè mú ẹnì kejì ẹ̀ jẹ́ pé okay, yes, this is Yoruba to salo. Yoruba is just not coming. But I mean, if we can understand English as much as it is that life is precious. Ayé tọ́lọ́run fún wa is a gift from God to us. And by the time we go back to God, we must be able to account for what we have done with the life. God will not say, how many children did you have? So he's the one that gives the children anyways. Even how many did you marry? If you don't marry, I curse you out. No. But your life must be, when you go back to your maker, he would ask you, what have you done with the life I've given you? It's not about the children. It's not about the husband. No. It's about how you make life, how you make the world, how you exude what is put in you to the world. It's as simple as that. And you must find that thing, that one thing, or that two things, or that three things that it is for you. Sorry, Yoruba did not come today. Maybe another day.
I could have translated for you.
Please do. Please do. Or maybe somebody else can do the translation. But I don't know why Yoruba is not coming. It's just not coming this evening, but it will come another day.
Okay, yes.
Nǹkan
tí arábìnrin wa sọ ní pàtó ni pé ká kọjú mọ́ nǹkan t'Ọlọ́run bá rán wa wá ṣe nílé ayé, ìyẹn ni ká kọjú mọ́, pé ká má rò pé tí a bá bímọ pé ó ti tán, torí ó ní nǹkan púpọ̀, nǹkan pàtàkì t'Ọlọ́run fẹ́ ká fi ayé wa ṣe, tó jẹ́ pé ó máa jẹ́ kí ayé dùn, ó máa jẹ́ kí gbogbo àgbáyé gan dùn, tó jẹ́ pé Ọlọ́run ti rán wa. Ìyẹn ni ká kọjú mọ́, ká dẹ̀ wà ní àlàáfíà, ká wà ní ká máa jẹun dáadáa, kí inú wa máa dùn, ká má bẹ̀rẹ̀ sí máa gbé ojú ká má bẹ̀rẹ̀ sí máa gbé ojú tí ò dáa káàkiri, kí inú wa má dùn sí nǹkan ire ẹlòmíì, àbí kí inú wa má dùn sí ara wa bí Ọlọ́run ṣe dá wa. Ká máa dúpẹ́ lọ́dọ̀ Ọlọ́run nínú gbogbo ibi tá a bá wà àti gbogbo ibi tí Ọlọ́run bá fi wá sí, ká máa dúpẹ́ lọ́dọ̀ Ọlọ́run. Nǹkan tí a bá dẹ̀ ń retí, Ọlọ́run máa fi fún wa. Ẹni tí ó bá bímọ, oríṣiríṣi èèyàn náà ló máa bá tọ́jú ẹ̀. Ẹ̀yin náà ẹ bẹ̀rẹ̀ sí máa tọ́jú àwọn ọmọ, kẹ bẹ̀rẹ̀ sí máa ṣe dáadáa sáwọn ọmọ. Èèyàn lè kọ́ àwọn ọmọ, èèyàn lè tọ́jú àwọn ọmọ. Kí inú wa dẹ̀ máa dùn sí nǹkan tó dáa, sí àwọn ọmọ, sí gbogbo nǹkan tó dùn, sí gbogbo nǹkan tó dùn, ká dẹ̀ máa ṣe dáadáa. Ọlọ́run á dẹ̀ rántí gbogbo wa sí rere. Ẹ ṣé. Okay.
That was precise.
Thank you. So the last question is that, Doc, now that some of us have waited too long, does that make it too late? And we would end the discussion on that note, because it's only with God all things are possible. It's humans that can say something is late. With God, it's never too late. And once there is a strong desire, we can still find a way. So we can continue to try. I'm just saying that let us not get into a place where we are trying so much that we have lost the joy of living. Life is for living. Let us have joy in living our lives while we go about the pursuit of what we desire. You want to give us your final words, Busolami?
Yes. For the woman who said it's too long, I know that feeling. Like, I mean, having to wait for 20 years for a child, and then you get to the doctors and they say, Madam, sorry, your age, and start to give you answers that are really heart-wrenching, heartbreaking. Of course, for her to wait for that long, she must have held up a lot and tried to make herself happy and not live a life under the yoke of that. But there's still that desire inside. But there are other means, like there are other options which religiously may not be open to, which culturally may not be open to, but you have to ask yourself, what do you want? What is the most important thing? What is that thing that would spike up your energy and spike up? And that is only you that can answer that question. So, and once you only answer that question, and then you decide on what you want to do, and then you move on regard that. What I'm going to say to everyone is, first of all, thank you for your time. Thank you for having me, and then thank you for the questions. Like I've said before, that in this pursuit of wanting a baby or wanting a child, you must have information, and you must seek it out, and you must ask it from the people that have the information, so that you are well able to make an informed choice and you are confident about your decision that you have made. Thank you very much once again.
Thank you very much. Thank you very much. Well done. Thank you, everybody, for joining us. I'll just run through the topics that we have coming. So we've done assisted reproduction overview, but we talked mostly about IVF. Busolami talked mostly about IVF very brilliantly. Thank you for that, Busolami. And next week, Saturday's topic is egg freezing and egg donation. And that is something that is very common now and something that is quite topical. So let us not miss that session. The following week, we are talking about surrogacy, and that's also a very topical issue, very important, whether it's something you want to do or not do, what are the ethics of doing such. That's what we are going to be talking about on the 12th of November. And Busolami is taking us in the next two topics, and myself. Following that, we're going to be talking about sperm banking and what makes good sperm. And that's on the 19th of November. And a professor of urology is going to be taking us in that. Following that, we're going to have miscarriages and when does life begin? And a professor of obstetrics and gynecology is going to be taking us in that. Then we're going to have foster parenting. On the 3rd of December, we're going to have adoption, which is a discussion that we are going to have. We're going to talk about adoption in Nigeria, how things are in the UK. It's going to be an open house discussion on adoption. And then the final topic on the 17th of December is going to be on single parenting and elective lone parenting, meaning you just decide you want to be a parent, you've chosen that for yourself. It wasn't as though it was thrust on you. And single parenting will be those that have found themselves by virtue of circumstance as a single parent. And it's an exciting time ahead. Thank you so much for joining us today, and hope to see you again next week. You're welcome to join Find the Link. Please check this other episodes in the series we've done on the YouTube channel. And for those that joined us on YouTube, we're very grateful. Thank you for your time.